Hey guys, in this video I'm going to show you a very different type of stretching that you can do for stroke, especially for your ankles, your knee, your wrist fingers and also your elbow. This is going to be different in the sense that most of the stretching that I've shown in this channel tends to be just a hold. That means you just pull and hold. But this stretching that I'm going to show you today involves two components. One is the active contraction and then the second part is the static and the stretching component of it. So it is quite different and you may not be very familiar with this form of stretching. So do watch closely and pay attention because there's going to be a lot of instructions that you need to follow for this type of stretching. So welcome to Basically Physio. My name is Suresh and I'm a physiotherapist. A quick disclaimer is that none of this replaces professional medical advice and I do this in my personal capacity and do not represent anyone. So for this stretching, what you're going to need is you're going to need a towel and also you're going to perform it in a seated manner, so your chair has to have an upright back support. So the protocol for this stretching is going to be slightly tricky, just listen carefully. In all of this exercise that I'm going to show you the stretching, there's going to be the active component where you're going to stretch for and hold for 10 seconds, followed by a 2 seconds of rest, and then that's going to be followed by another 10 seconds of static stretching. Okay, so this is one cycle. I want you to do a total of 3 cycles of this protocol of stretching and followed by the 4th cycle, which is just going to be a static stretch for 60 seconds. If you're confused, watch the remainder of the video. I'm going to show you exactly what you need to do for your ankle, your knee, your wrist, finger and also your elbow. Okay, so starting off with the ankle, listen carefully. For most of the time, the ankle issues that you're going to face is that you may not be able to bend it upwards like this. So meaning your ankle is going to be tight and going to be pointing downwards like this. So this is the ankle that we're going to show for the exercises. There's going to be 2 components in this stretching and for all of this exercise, going to follow the same. What you're going to do is you're going to try your best to actually bend your ankle upwards and hold it for 10 seconds. Okay, so you may not be able to bend all the way because of the tightness that is limiting you. That is fine. Okay, I just want you to actively try to contract the muscles, and even if you just get flickers of movement, that's also fine. Okay, we just want to have some activation of the muscles. So you want to hold it up as much as you can for 10 seconds. Okay, hold it for 10 seconds. Okay, and then you can relax the legs for about 2 seconds and then grab your towel, okay, and put it at the front of the foot. Okay, so after your 2 seconds of a rest, what you're going to do is you're going to use your stronger hand to pull your ankle into upwards movement just to stretch your calf area. So you're going to pull towards you to really get your ankle to bend upwards. Okay, so I'm going to go through again. Okay, I'm going to do it slowly now. So the first part of it is to actually bend your ankle as much as you can upwards and hold for 10 seconds. After 10 seconds of holding, you want to relax your leg for about 2 seconds and then quickly grab your towel. At the end of the 2 seconds, you want to pull and stretch it for another 10 seconds. Okay, so this is the part where it can be a little bit more confusing. You want to actively contract for 10 seconds, followed by a 2-second break, and then stretching it with a towel for another 10 seconds. Okay, so just to go through it again, what we are going to do is you're going to bend your ankle up and as much as you can. You do not have to go all the way up like this. Okay, hold it for about 10 seconds. And then relax your ankle for 2 seconds while you grab your towel and put it up here. And using a stronger hand, just pull it up and hold for another 10 seconds. Okay, so this 10 seconds of active contraction followed by 2 seconds of rest and another 10 seconds of stretching. This is one cycle. And I want you to do 3 cycles for your ankle. And all of the joints that we're going to do, we're going to do 3 cycles. So let's say that now you've done your 3 cycles. For your 4th cycle, what I want you to do is just a normal basic stretch, which you're going to hold for 60 seconds. So you're just going to pull this and hold it for 60 seconds. Just a normal static stretch, which I have shown before. 60 seconds, and this is how you do the stretching exercise. So this is for your ankle. Now we're going to go for your knee. So we're going to focus on the knee muscles here, mainly the back muscle of the knee, the hamstring muscle. This is the one that's going to be tight. Okay, so this is my tighter leg that I'm going to show you the demonstration on. What's going to happen is first I want you to sit out of your chair a little bit more. Okay, once you have done that, what's going to happen is you're going to try to straighten your leg as much as you can. You may not be able to straighten it all the way because the reason you're doing this is because you have tightness here, right? So you may not be able to do it all the way like this. That is fine. If you are just going to be able to straighten as much as you can like this, okay, keep it in this position. And what I want you to focus on now is Looking at your quads, that means the muscle that is on top of your knee, above your kneecap. This is your quadriceps muscle. I want you to try and activate it. Okay, so contract the muscle. When you do that, naturally your leg is going to go into a more extended position. Hold it for 10 seconds. Okay, so hold it for 10 seconds. Okay, and after the 10 seconds, relax for 2 seconds, and your body on this side of your leg here, your body and your hand reach forward, and as you're reaching forward, you're going to try to push this knee backwards a little bit for 10 seconds and reach forward. Combine this for 10 seconds and relax. Okay, so the body bending forward and your hand reaching down this way while you're pushing, it is a stretching component for 10 seconds. So let's go through this again. So you want to sit out of your chair a little bit more. This is the tighter leg. You're going to keep your leg extended out as much as you can. Okay, now we're going to start the routine. So first thing is you're going to activate your quadriceps muscle. You're going to try and straighten it as much as you can for 10 seconds. Okay, hold it for 10 seconds. Okay, then you relax for 2 seconds and immediately go into a forward bending and reaching down this way, and your hand, you're going to push your knee downwards. Okay, this is for another 10 seconds. So you have just done 1 cycle and you're going to repeat it 3 cycles. Okay, so you're going to contract for 10 seconds your quadriceps muscle. Okay, 10 seconds over. I'm just going along the motion, but do count 10 seconds yourself. Relax for 2 seconds. That means completely relax your leg for 2 seconds. And now reach forward using your stronger hand. And you can also gently push down your kneecap down to feel the stretch of the hamstrings muscles. Okay, this is for another 10 seconds. So this is your second cycle. And now we're going to do a third cycle. So contract your quads area. Contract it. 10 seconds. Okay, relax for 2 seconds, and then using your body in your trunk and your hand, reach forward for 10 seconds while pushing your knee down as much as you can. Okay, for 10 seconds. So this is your third cycle. Okay, so 3 cycles done for your knee. Next, what you're going to do is just go into a static stretching for 60 seconds. So this one, no active component, just bend forward and really feel the hamstrings muscle stretching for 60 seconds. So similar like your ankle, this is what we're going to do for all the joints. Okay, 3 cycles of the active and static stretching, and your 4th cycle, you're just going to hold it for 60 seconds. As you can see, this type of stretching requires a lot of thinking and a lot of forward planning, so it may not be suitable for any and every stroke survivor. It will be more suitable for stroke survivors who are able to appreciate and also follow exercise instructions carefully. So if you're having difficulty with this, what I suggest is that you can get your family member or caregiver to watch this video with you and help you to guide along in the exercises. If you find this content useful, do consider liking and subscribing to the channel. Also, you can sign up for my weekly newsletter, Rehab Recovery. Okay, so coming to your upper limb, you're going to start off with your elbow and then moving up to your forearm, and then lastly your wrist and a little bit of your fingers. Okay, so for your upper limb in your elbow, most of the time what's going to happen is that your elbow is going to be up in this manner. Okay, most of the time your biceps is the one that's going to be tight. So we're going to focus on stretching this biceps to be more straighter this way. So what you can do is you can get a table like this so that you can rest your elbow, so it'll be a bit more easier. Okay, so for your biceps, what we are going to do is the active component, the rest, and the static component, same like your lower limb, right? So first thing, what's going to happen is you're going to try and just straighten out your elbow like this as much as you can. If this is how much you can go, then just stop there. If this is how much you can go, then just stop there. Wherever you are, just stop it. Where it's comfortable to stop it. Okay, so now we are going to focus on activating this biceps muscle. So what the bicep does is actually actively go this way, right? So we are just going to put your stronger hand over at your forearm at the distal portion here, and we're just going to try to activate your biceps. That means if your hand is not holding here, your weaker hand is going to go up. Okay, but even if you have not much strength, that's fine. You just want to activate this muscle here. Okay, so you want to activate like this for about 10 seconds, just gentle contraction. Okay, so you hold it for about 10 seconds. Okay, once that is done, then you rest for 2 seconds, and once you are here, you just try to straighten out your elbow like this. Okay, you can either put it at the side of your body here, or you can actually use the table as a fulcrum and just extend your elbow further down. But because there will be a portion where you may not be able to extend straight, then you can just put it out and extend this way. You can even put it in your lap and also extend this way. Okay, so extending the static stretch is about 10 seconds. Okay, so go through the cycle again. We're going to go through 3 cycles, and then the 4th cycle is just a 60-second stretch. Okay, so first thing for your bicep, you're going to activate your biceps and just bend your elbow this way. Bend your elbow for 10 seconds. Okay, hold 10 seconds. Once the 10 seconds is up, you want to rest for 2 seconds. After that, you go into stretching your elbow further down for another 10 seconds. Okay, so once that 10 seconds is up, this is your first cycle. Okay, then you're going to go ahead and do again. Stronger hand put here, bend your elbow for 10 seconds. Okay, you're activating your biceps muscles for 10 seconds. Once 10 seconds is over, you rest for 2 seconds and go into a position to stretch it up for another 10 seconds. Okay, so this is your second cycle. So imagine you've done 3 cycles. Your 4th cycle, what you're going to do is just going to extend. Using a stronger hand, just extend this way. Or you can even grab your wrist and extend your hand this way like this. Hold it for 60 seconds. Okay, this is your 4th side. So for all of this stretching, you do not want to push past pain. Okay, whenever you feel pain, just ease off a little bit and do the stretching at that angle. Do not push beyond that and feel pain when you're doing the stretching. Then it's not going to be beneficial for you. Okay, so 60 seconds, this is for your biceps muscles. Okay, now coming to your wrist, what we're going to do is we're going to stretch out the muscles here. Most of the time, the problem that happens in your wrist is going to bend up this way and your fingers will curl. Fingers we'll do later, but we're going to focus on the wrist first. Okay, so we've done elbow, now we're moving to the wrist. So for your wrist, I want you to put your hand in a position like this. Not palms up and not palms down, but midway. Okay, midway like this. So most of the time, your wrist is going to come into a manner like this, right? So what we're going to do is you're going to just actively contract your hand to bend this way, your wrist to bend this way. Okay, so you do not have to give any resistance. You just have to gently contract your hand. If you want, you can block your hand for about 10 seconds here. So bring your wrist down like this, bend it for 10 seconds, rest for 2 seconds, and then next, your stronger hand, grab your wrist and go back this way. Okay, so for the angles that I'm showing you, I do not expect you to be able to do these angles at the start. Okay, just at the start, you just want to do within the range that you are able to and within the pain-free range. Okay, so we start again. Your first cycle, what is going to happen is you're going to bend your wrist this way while blocking this. Okay, the blocking is optional, but it's good to just give it so that your hand does not curl up a lot more. So just bend your wrist down like this for 10 seconds. Okay, once your 10 seconds is up, you rest for 2 seconds, and then using a stronger hand, stretch your wrist this way. So another way, you're actually stretching your wrist backwards for 10 seconds. Okay, so one cycle down. Second cycle, bend it forward like this and use your stronger hand to block. Block for 10 seconds. And you want to rest for 2 seconds. And then stretch it for another 10 seconds. Okay, in this video, I'm not showing you the entire 10 seconds, but when you're doing it by yourself, please make sure to count 10 seconds and do it according to the protocol that I'm sharing. Okay, so now let's say you have done 3 cycles of this. Your 4th cycle, what's going to happen is you're just going to hold the stretch for 60 seconds. Okay, so if you find that this is difficult for you, sometimes in a standing position, you can just put your wrist like this and bend it this way, if it is not painful for you. Okay, but for majority of you, this may be painful if you're standing because the angle, you may not have access to it. So just go and do this for about 60 seconds using a stronger hand. Okay, now we're going to move to your fingers. Most of the time, the problem is going to be like this. Your fingers are going to curl in this way, and sometimes they are going to be even very tight into like this manner. If this is the state where you're stretching your hand, beginning to stretch your hand, I would like you to check out this video that I'm linking in the top right hand corner of this video. You can see the link. Watch that video first before you watch this video, because this position is too tight for you to stretch and it'll be very painful. You may not find this stretching that I'm showing you beneficial. So go ahead and watch the other video that is being linked up here. You can find it in the description also. Watch that, then come back to this when you're ready. So for the rest of you guys who do not have extremely super tight fingers, but you're having some movement in your fingers, what's going to happen is you're going to get into a position similar to stretching your wrist, okay, in a midway position like this, not down, not up, but midway. Okay, in this position, what you're going to do is you're just going to block your finger pads here if you have access to them. If not, just slightly below your finger pads. You just want to curl your fingers gently, just very gently, about 10 to 20% of contraction. Okay. After that, what you want to do is you want to hold for 10 seconds, right? Then rest for 2 seconds, and then turn your hand up this way. Using a stronger hand, try to extend it as much as you can within the pain-free range for 10 seconds. Okay, once that is done, this is your first cycle. Go ahead and go and do 3 cycles. So fingers, either at the finger pads of your weaker, tighter hand or slightly below the finger pads. Then after that, curl your fingers down this way for 10 seconds. Okay, once your 10 seconds is over, rest for 2 seconds. And then turn your hand down this way, stronger hand over, and stretch it out as much as you can within the pain-free for 10 seconds. Okay, so this is your second cycle. Go ahead and do a third cycle. And for your fourth cycle, you just put your hand down this way and just use your stronger hand and stretch out your fingers as much as you can within the pain-free range. I hope this exercise will be beneficial for you. Do share with me in the comments on how you go about doing them and what the benefits that you take from each of these exercises. If you want to watch more content, especially for your upper limb, look at this video on the left. And if you want to have a more full body workout, take a look at the video on the right. And thank you, and I'll see you in the next video.